Jonathan?
Good morning. The meeting was called to order at 10:02 with a recess to 10:07. And at this time, Madam Secretary, if you can call the roll.
Morning, everybody. Let's say adoptive family, Jessica Pagan.
Present.
Best Foot Forward, Debbie Elman. Card at FAU, Sabrina DeGoges. Card at FAU, Jack Scott. Coalition for Black Student Achievement, Dr. Deborah Robinson.
Present online.
Thank you. Coalition for Black Student Achievement, Deborah Stewart.
Present.
Compass, Amanda Canetti. Compass, Rex Barnes.
Present.
Connect to Greatness, Dr. Cassandra Corbin Thaddeus.
Present.
Connect to Greatness, Andre Thaddeus.
Present.
Welcome.
Thank you.
District ESC Advisory Committee, Kimberly Spire O.
Present.
District ESC Advisory Committee, Michelle Beatty. Welcome. Division of Blind Services, Cesar Vigo. Economic Council of Palm Beach County, Craig McKenzie.
Present online.
El Sol Jupiter, Suzanne Whitbeck. Florida Hispanic American Chamber of Commerce, Juan Pagan. He's absent today. Florida Hispanic American Chamber of Commerce, Evelyn Vargas. For the Children, Reggie Durandis. Gold Coast Down Syndrome, Sue Davis Killian.
Present online.
Guatemalan Mayan Center, Mariana Blanco.
Present online.
Hispanic Chamber of Commerce, Maria Antunia. Hispanic Education Coalition of Palm Beach County, Hector Pedre. NAACP, Diedrich Strawn. Palm Beach County Council of PTAs, Charmaine Postal.
Present.
Palm Beach County Council of PTAs, Marcus Brown.
Present online.
Palm Beach County Human Rights Council, Emmy Kinney.
Present online.
Tri-City Education Committee, Mary Evans. Tri-City Education Committee, Eddie Rhodes. Urban League of Palm Beach County, Terrence Reed.
Present.
Volunteer Association of America, Widline Pierre. And that concludes the attendance. We have 1, 2, 3, 4, 5, 6. We have a quorum.
Thank you, Madam Secretary. At this time, the approval of June minutes. The minutes were distributed via email to everyone prior to this meeting. Also should be in the calendar, as well as a separate email that was sent to all members of the committee. Motion.
Motion to approve the minutes.
Thank you, Kimberly. There's a motion to approve the minutes by Kimberly Spiro. There's a second by Debbie Elman in the room. Any discussions regarding the minutes? All in favor? Opposed? Minutes approved as distributed. Each meeting, we allow 2 minutes per speaker for public comments. At this time, it is 10:12. We will allow 2 minutes per any public speakers. We'll start with any speakers that's online. At this time, is there any speakers online? Hearing none, any public speaker in the room that would like to comment or speak at this time? Hearing none, we will move on with the agenda. Unfinished business, vaping epidemic. We will give the floor to Mr. Oswald. And also, I'm sorry, if anyone else for the records, before Mr. Oswald takes the mic, if anyone who is in the room who have not introduced themselves or was not called in the roll, can you please introduce yourself at this time?
This
Sorry.
gets recorded, so you gotta make sure you speak in the mic.
Say it again. Good morning, everyone. I'm Dr. Mary Claire Musenik. I am the Director of the Department of Behavioral and Mental Health. Thank you for having me today.
Thank you for being here.
And Pete Stewart, I'm the Health Education Specialist in the Department of Physical Education, Health, and Driver's Ed.
Thank you for being here. Mr. Oswald.
Good morning, everybody. We have a great turnout here today. Just under the unfinished business, the vaping epidemic, last meeting we had, which was in June, we had a really good presentation around the issues with vaping and the consequences from health consequences to students, the widespread use of those vapes that are happening in our youth, and really need you all on your agendas moving forward. And what the ask was, and some of you weren't there, so the link there goes to the recording of that presentation at our last meeting. If you weren't able to watch it, but it's really important that you educate your constituents about the dangers and issues of vaping. You know, every day I'm reading another headline about another student who has serious health consequences, needing lung transplants, and tragically enough, dying from vaping, and it's not getting any better. We do have a district kind of mini task force that we're working on. So we're looking at everything from piloting vaping detectors for restrooms and things like that, to pilot that out to see if that might help to actually catch the students, right, that are actually doing it. But really, we want to educate, and we're working on at our schools, providing a lot of tools around educating students about the dangers of vaping. So again, if you haven't, I'm going to be talking about this throughout the year and giving updates. So if you haven't watched this presentation, I do ask you to view this. We have a large grant with the Department of Health through the Department of Education that provides the actual course that students take when caught with vaping to help deter the number of days for suspension. In addition, that team under Safe Schools, you'll get to see them really do an excellent job. And I know I'm kind of immersed in it, but even watching that presentation last time we had our last meeting, learned a lot of new things as well. So it's really, really a critical epidemic that we're going through, and we need more people really educating the youth about this.
Thank you. Let the records reflect that Cesar Vigo have joined us in the meeting. And I'm sorry, can you introduce yourself? Come to the mic.
Should I push? Awesome.
Yes.
So my name is Hector Piedra, representing the HEC, Hispanic Education Coalition of West Palm Beach. I'm a new member on behalf of Dr. Diaz. So I'm happy to be here.
Thank you and welcome. Thank you
Thank
for
you so
joining
much.
us.
Thank you.
Yeah, and Dr. Mendez left the committee, so Hector's taking that place.
Correct.
So
Thank you
we're
so
going to have
much.
you board approved, I think. This next upcoming board meeting will be. So.
Welcome,
you're here.
Hector, and
Excellent. Thank you so much.
thank you. Next on the agenda, updates from the DDEC subcommittee. Kimberly Sparrow or any representative from the subcommittee to share out.
Sorry about that. I was having trouble. The committee's work is ongoing. We went through and based on the presentation by Dr. Corbin Thaddeus, as well as the strategic plan for the school district, we came up with recommendations under several headings. And as of right now, we are working on the student voices section of the strategic plan, or specifically section B, student focused culture. And we are working to establish formal structures in educational experiences for students. We don't have our recommendation for that complete, and we plan to provide a full package of recommendations for all of the different categories in the strategic plan. So that is our update, and we are working very hard, but it's a very large project. If any of the committee members would like to add additional comment, feel free. Okay, hearing none, our report is complete.
Thank you, Kimberly. Any member in the room or online have any questions or comments for the subcommittee? Hearing none. If you would like to introduce yourself, I'm sorry. Thank you, Jack. Let the minutes reflect his attendance. Thank you. At this time, update from Chief of Equity and Wellness. Again, Mr. Oswald.
So again, welcome everybody, great turnout. And also I do want to, and what we can do, Ms. Holtzclaw, to send out, so for the subcommittee, some of you may have not seen Dr. Thaddeus's presentation that was back in April or May, I can't remember, but somewhere there. But we'll send you out the link. She did a great presentation about the supports that are needed for high-performing Black males and the systems that need to be in place. So to have more context for that subcommittee and recommendations they're going to be bringing forth to this group, I highly recommend that you watch that presentation. It was outstanding. We had a great conversation. So if you all could put that on your homework to-do list, school has started. So, and again, happy new school year. So we had a great beginning of the school year. A lot of the challenges that we're going through right now is just another wave of legislation that we're working through as a school district, from everything from how to teach reading to pronouns to school safety, and everything in between and outside of that. So we are working through all that. I know one of the conversations that often comes up is around books being removed from schools. The superintendent has gone on record, and we have a log that no books have been removed from our schools. So it's important that we control that narrative when you hear things out in the community. I know you get in touch with a lot of individuals out there, so it's important that people understand that. A lot of discussion also in this group in the past regarding gender identity. There has been a lot of challenges with new legislation there regarding restrooms use and locker room use, that students can only use a restroom if it's a group-style bathroom based on their biological sex at birth. So we've been working to educate around that. However, at the same time, we've been working on trying to have a number of restrooms, single-use restrooms that are gender neutral and open, so that students will have those options as well. Regarding pronouns, we've been working to educate and preferred name or nickname. So new rulemaking came in on those as well. So we're working to educate about our staff in particular. It affects employees as well regarding the use of pronouns, and that has to be aligned to, again, their biological sex at birth. In addition, we are not allowed to ask students about their pronouns and the use of, and any name that a student wants to be called outside of their legal name it has to be approved by a parent. So we have a process in place through the registration form where parents sign off and approve that particular piece as well. So those are some of the big highlights. There's a lot more legislation that's going on, but I just wanted to cover that because I know those are a couple of topics that do tend to come up. And some of the other things that we talked about in the past, I just want to mention about the school attendance, and I will be doing an update on school attendance. We are working on a large toolkit to increase student attendance. Our truancy and absenteeism rate, if you were part of this last year, you saw are at an all-time high. And we really want to curb this. And the number of kids who are actually truant is also extremely high. So one of the initiatives that we took upon last year was to file truancy petitions for students who just were not coming to school, and that was part of our re-engagement post-COVID. That has worked out, I guess, well in one sense. At the same time, it's really shining a light on the complications that many of our families go through. So through those petitions, parents actually have to come to court. And we're currently using Judge Kroll as our assigned judge right now that is working through those processes. What I can tell you, the themes are probably nothing that you all wouldn't suspect, but typically what the themes and what the parents are faced with, most times, all the ones that we filed so far are single parent moms, multiple kids, unemployment, housing, food insecurity, basic needs, really kind of a sense of hopelessness that a mom may be going through. And so we're really working through a process to have the support systems built in place through community partners to really assist and helping stabilize the family, but at the same time getting the students in school. And so we've had a lot of successes from all the way out to the Glades, to the coast, and in between, getting students that are actually now back in school. So that's the good news. But we want to really push out the message that attendance is critically important, and we need to make sure that kids are in school. So as much as you can get that message, we got to make sure that our kids in school. Just the missing one day has an impact, and we have research to show that it impacts their academic outcomes. Also, regard to student voice, I know we've talked about student voice a lot in here, and a lot with Dr. Thaddeus's presentation came up with that. One of the initiatives does speak, in the strategic plan, speaks to student voice. We are rolling out the 7th, introducing the principles and rolling out a student voice, for lack of a better word, playbook. Ms. Simmons is also on this committee that has been working through that. And one of the data points we looked at last year on our school effectiveness questionnaire was regards to student-to-student relationships and the concern that students feel that they're not as good as they can be, right? And it was clearly an issue that needs to be addressed. So we're really using that data point because the students have really voiced that there's a problem here on our school campuses. And going to implement this playbook where every school works, if they don't already have in place, but a process to create a committee of students to really look at, you all said this on our school effectiveness questionnaire, so one, getting some of the root causes of why this exists, and then moving into problem solving based on the voice of the students. So pretty excited about this. And how this will go. Built into this playbook, we worked with a couple different partners around some research about the best way to, if I have a group of 10 students, but are we really hearing from the entire student body? So there's protocols and process where those students who go out and get more student voice from all. So really to address, in particular, the culture and climate on the school campuses, because we want all of our students to feel safe, connected, and welcome. So I'm really excited about that. And I'll provide updates throughout the year on how that's going, but that is rolling out to the principals next month. Also, last year, we talked a lot about House Bill 17, they're all blending now, the numbers. The one that really had impact to our immigrant families, our undocumented families, as it related to basic healthcare challenges, employment. And so we really sent a lot of resources out to our schools. I want to thank Guam Allen Center here for your partnership. We did release your information off to let parents know where to go to for assistance and support. We're also watching closely House Bill 1, which has to do with the universal vouchers. So essentially, we've had a lot of vouchers for many years in different forms, but essentially this eliminates any cap on income in a household. So, and it also opens up to the private schools and homeschool. So we're watching that closely and that impact. Right now, our enrollment seems actually up, maybe roughly 200 to 800 students. It's kind of, today's our 11-day count so that we actually solidify that. But right now, our numbers are looking pretty solid. We'll have a better update at our next meeting about what those numbers look like. But so far, we want to make sure that everybody knows that when it comes to educating a child, that Palm Beach County is your best choice. And feel free to use that tagline. So those are some of the updates that I wanted to follow. Oh, last one I wanted to, and I talked about this last year, and I think you had a request that I didn't follow through on, so I did just put that on record, that you wanted the information about when it brings weapons on campuses. So guns, knives, tasers are big issues that get a lot of students into trouble. Tasers are the most problematic, where people do not realize that a taser falls under zero tolerance and does face expulsions. Our school board does not like dealing with these issues. The number one reason that always comes up from the students and the families is that the parents gave to the kid for protection, for transporting to and from home, and for protection reasons. And so it's really heartbreaking to hear a lot of these kids in these situations. So I have a clip with Chief Mooney that goes through a lot of the issues. It also, the online post is another big one, posting threats to, shoot up and all those issues. So I'm going to ask again that you please, every time you're in front of a group of people, to let them know, do not bring those on our school campuses. We are piloting, you probably seen on the news, metal detectors at 4 of our high schools, which seems to be working out fairly well. But tasers are the most problematic. And if there's an issue for transportation to and from school, just let the family reach out to the administration so that we can help problem solve to try to work with another way around that. And then also with that, threat management, threat assessments, we've talked about threat management is a lot of changes just approved yesterday by the State Board of Education, a new Florida model, so we're going away from our CSTAG model. When it comes to school safety, we have to train all of the schools' threat management teams this first semester for implementation of the new model on January 1st. This is actually really good legislation, I think, that will help work to keep our schools safer and really catching students earlier that are on that pathway to violence and keeping our schools safe and really focus on the prevention, not just the intervention. All right. It's a change in state statute stemming from the Marjorie Stoneman Douglas commission meeting that brought forth recommendations during the legislative session. Rulemaking happened yesterday around that from the DOE, State Board of Ed. Yes.
At this time, if we have any questions, beginning and alternating from online to in the room, Dr. Robinson, you're recognized.
Thank you. So I have 3 things. First is, can you give us, I guess via email, more information about the Truancy Initiative? How many students were involved? I know you mentioned kind of globally the issues that the the families were facing. But if you have any details about, like, I don't want identifying information, but case by case. And then, most importantly, how did this initiative help them address the root cause of the truancy? If we could get that on follow-up, please. Secondly, if you could share the clip that you referred to that Chief Mooney did. Thirdly, so on the books. So, I mean, I've seen the public information response in terms of challenges and, you know, and all of the challenges that I saw basically had been, there were no changes in the availability of the books, as I recall. But what dawns on me is there were a lot of changes at the end of last school year. Or wait a minute, time has flown by. Was it last school year or was it the year before? When all this started coming down hard, and then all the teachers were asked to evaluate their classroom libraries against basically the new law. If we could get some follow-up on what is no longer available to classrooms or students, whether it's in the media center or the classroom, because of that. I get the challenges part, but I think we lost a lot of thoughtful materials children could be exposed to in that step of the whole. And then my last is if you could later give us some follow-up on the changes in the threat assessments. You said it's good legislation. Fine, it makes me paranoid. I would just like to be better informed. Thank you so much.
Yeah, if I can just respond quickly to the books move. So the books in the classroom, books would have just moved out of the classroom, went through that vetting process. If they were related to anything instructional, or there's a special location media centers based on age appropriateness, depending on the type of book. So I don't know if we track every single school, and if books like that were moved, Dr. Robinson, so I probably won't have that information. Yep.
Okay, I'm sorry, may I follow up?
Sure.
Would not the media specialists know? Because they were part of that evaluative process, correct?
I don't know
only
the
teaching,
details, but I don't believe we're collecting it, but I'll check. I don't think we're collecting from every single school, but I'll have to check with Dr. Sheffield and.
Collecting books?
No, just if we're tracking every single school, if books were moved or not. I don't know if we're doing that.
I don't see any questions in the room, so I'm going to go, oh, I'm sorry. Yes, go ahead, Debbie Ellman, if you can turn on your mic.
It's my first turn on. For the nicknames, is the parental permission kept anywhere on SIS where we would have access to see that it was done?
Yes, it does get entered into SIS. So at the top of the registration form, we put the legal name. To the right of that, there's a box there for preferred/nickname. And that data processor will update it in SIS to reflect student rosters and things like that.
Perfect.
Yep.
Amy Kenny, you're recognized.
Thank you. On the same note, I'm wondering, is that parental permission required for all nicknames or only those that have to do with trans children? For example, if someone's named Robert and they go by Bobby, is the same process required for that kind of name change?
So it applies to all students if it's a derivative of your legal name. So if Robert wants to go by Rob, we will utilize that. Jonathan wants to be called John. From Robert to Bobby, I believe that would have to require the form to go and a nickname and the parent to sign off.
Okay,
And it applies, so it applies to all students. There was a new rule this summer that applies to all students. It's not just transgender students.
But if if it's derivative, like a shortened version of their legal name, there's no process required.
Right. And if their legal name is Bobby Joe and they want to be called Joe, they can be called Joe because that's part of their legal name if that's what's on their legal name. They could also be called by their last name. That's their legal name. That doesn't require any type of form change.
Okay, thank you. And if they would like to make a name change in the middle of the year after the initial registration process has happened, who would they go to make that change?
So they could either just print a registration form, update registration forms from the district website, or go to the front office to get a registration form and just complete that, sign it, turn it into administration, or to the front office to have that change, and data processor can update it anytime.
Okay, great. I just have another, like 2 more questions. Is that okay?
Sure.
Okay. So I have a question about not just name changes, but overall, like reporting back to parents if a student comes out to a teacher. I know that that's part of the law. I'm wondering if that applies to school counselors who are, conducting like counseling sessions with students. Are they required to out those students to their parents, or is it a different case because they are a counselor?
So every situation is a little bit different. So without having specifics of a scenario, it's hard to answer that question. If a student's going through counseling, and parents would have signed off on that to begin with. So it really depends on, we've got many different situations that come up in the space, so it really depends.
I think that's part of the problem, is that there is not a clear guidance. I'll just tell you, in my community, I'm getting counselors who are very upset, and they don't think that they can, every supervisor, every principal, every school is kind of giving a different message, it seems like, about what's allowed and what's not allowed. So I'm just wondering, at the district level, what kind of guidance is being issued?
So we just sent out last week our updated LGBTQ guide to schools. So schools will have that now. So often if it's a situation that they're unsure about, is to go to administration. Administration can contact the district or legal department for guidance around specific scenarios and situations. And yes, unfortunately, we didn't get a lot of clear guidance from the Department of Education. So we're trying to work through these complicated situations to ensure that our students are safe and affirmed, and to totally understand that I'm sure you're getting calls.
Yes. So is that LGBTQ resource guide available online? No?
I have to see, we just sent it out. I have to see where it's posted. I can follow up as a follow-up to the group to where it's at.
Amazing. That would be great. Okay. That's all I have. Thank you.
Thank you.
Thank-
And I do want to say, on that guy, we were working with Equality Florida a lot on that development, who get back and forth with that piece.
Thank you, Ms. Kenny. Thank you, Emmy. Is there anyone else in the room that have any questions at this time or comments? Going back online, Kimberly, you're recognized.
Thank you. I wanted to comment on the school safety rules that just came out. While prevention, I'm all for it, and I wish almost all of it related to that. There were changes that are troubling. Threat assessments tend to target students with disabilities and Black students far more often than anyone else. So I just wanted to let the organizations know that instead of having an option where the 2 key leaders of the threat assessment team initially try to determine whether there was any credible threat made at all. That has been eliminated, and all students who are alleged to have made a threat, whether or not they did at all, because sometimes bullies will say, Sally said blah, 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 and Sally never did. Anyway, they're all assumed to be guilty, and it's just a matter of, on the threat assessment, whether it was a low-level threat, a medium-level threat, or a high-level threat. And that is very problematic, in my opinion, because there are a lot of times there are allegations that turn out not to be true. And I guess the time for commenting is gone, but please be aware of that for your different constituencies.
Kim, I just want to push back a little bit on that. I actually think it's the opposite. And again, we didn't start training schools yet, but I've read over the training materials. And the reason about having a chair, there's not going to be a chair and a vice chair at each school as well as a district level, is to eliminate these incidents that come to the threat assessment team that are not a true threat, right? They're to work through it more administratively or disciplinary if appropriate, depending on the situation. But some of these, to your point, we're taking every single thing that happens to the threat assessment teams where it's really doesn't meet any type of a level of a real true threat. So now that, part of that is really through the training that we're going to provide. And the DOE, our district, we're training 8 individuals to get trained from the DOE the second week of September and they have to go for 3 or 4 full days to work through that. So when we turn around and then start training our schools to help work through those pieces, to help reduce the number around that. So, and that's coming from Sheriff Galtieri from Pinellas County, who chairs the MSD Commission himself, to realize that there is an number of cases that are going forward that shouldn't be. So
Okay.
he's seen that.
May I see what was sent out, because what was initially sent out for comment was different, I guess.
If you Google the Florida State Board of Education meetings and look at yesterday's agenda, the archive, probably under archive now, there's about 25 new rules that came out just yesterday.
Okay.
But you, Florida State Board of Education meetings, and look at August 23rd. It'll be on that agenda. You'll have you can see they have the manual there. They have the new rules there. So it's very transparent.
Okay, thank you.
Rex Byrne, you're recognized. Ms. Burns.
Hi. Yeah, so I just had a clarifying question because I already had the support guide that we were talking about earlier. And in there, I was trying to find it. In there, it specifically says that teachers do not have to out a child to the parent if they do not feel the child is, I was trying to look for the exact verbiage. But Emmy, I did send it to you in an email, the full guide, and we can share it out to whoever. But I thought it specifically said, and I just wanted clarification, let me find where it's at, that you do not have to out a child unless there is a change in
Service, educational service.
Yes. So just for a kid coming out as trans or LGBT, the teacher does not have to reach out to the family. So I just wanted clarification because what you were just saying was that they kind of do.
No, I never said that, for the record. So that was not me. So I think, Emmy, you might have alluded to that, but.
Sorry, yeah, that was me. And if that's not the case, that is what the community thinks and is saying. So I just want to say that's why I said that. But yeah, that was me.
I've had parents and teachers that have reached out about that also. And from this guide that was sent out, which is highly condensed, it's 11 pages now, it specifies they do not have to do that. So I just wanted clarification.
Right, so it depends on the situation. If it meets where it's a change in educational service, it may mean having a conversation and working with the parent. Again, I can tell you there's a lot of different scenarios that I've heard, and that's why it's difficult to say. It's not like a blanket, everything applies, but correct. If a student just discloses it and nothing has changed, You're not just going to call the parent to tell them unless there's some other circumstances that arise.
Okay. And is this guide going to be sent out to all teachers? Because a lot of teachers are misinformed about that information.
So it's just changed, it was just sent out Friday to schools, so principals will be working through that process.
But they're going to send it out to all teachers? Because I know they haven't done that in the past.
I have to
where the
check
teach-
with Deputy Superintendent around the directive that he put out to the schools on that.
Okay. Thank you.
At this time, any additional questions for Mr. Oswald regarding updates? Seeing none in the room, seeing none online. Thank you, Mr. Oswald, for those updates. And new business. I do see that there are 3 new businesses, the review of Policy 109, FY meeting calendar, and Policy 520. Just want to take just a few minutes out, if there is no objection, because it is not on the calendar. However, it is something that we should be doing, is voting on the chair and vice chair for this year, but it's not on the calendar.
So
Should be
actually,
reviewing it.
so with that, with the policy 1.09, and that was sent out to you all, actually, it allows for the chair and the vice chair to remain up. This
There's no
policy was
term.
recently updated. Pardon?
There's no term, however, there's no term for the
Up to
chair or
4
vice
years.
chairs.
It allows for up to 4 years in the policy.
In the DDEC policy?
No.
And see, that's the ambiguity that follows according
that's what you
to.
were telling me the other day.
Yes, that's the ambiguity. Policy 109 says one thing, however, the DDEC policy says something else. And according to legal, it was to go by the policy that governs this particular body. So this
It
particular.
would, yes.
Yeah, so
I need to
policy,
go.
DDEC policy states that we don't have a term, however, we should be reviewing who is going to remain as the chair and vice chair.
So I can, because it has to be public notice, I could put that on for our
Next
next
agenda.
meeting.
That is fine.
And then review, I can't remember the detail, but I'll review the DDC policy.
That is fine. Not the
No, it's,
0.987,
yeah.
27 or something like that. At this time, we can proceed, and we'll table that for next month if there is no objection to table the vice chair and chair position nominees. I do not hear any objections, so we'll proceed with this agenda today. Thank you. Review of Policy 1.09, Advocacy Committee to the Board.
Yeah, so, which now, Vice Chair, there may be, I need to look over the DDC policy, it says about meeting dates. So one of the things in 1.09, so 1.09, that particular policy, most of you, I think part of your onboarding, that's the board that really governs, the policy that governs for the school board, all of the number of committees that exist like this. So there's a number of them. And then this particular group has another policy. In 1.09, it states that the number of meetings can be, at minimum, has to be quarterly, so 4 a year. Historically, yeah, and I'm just looking at the DDC policies, that the number of meetings would be in compliance with 1.09. So typically, we have been meeting 10 times a year. Typically, it was all months except for December and July. So wanted to have a discussion, so we bring forth proposed dates for the rest of this year. What this committee would like to see to moving forward, if we want to continue to pass practice, reduce the number at all. So I just wanted to have some feedback from the committee members on their thoughts on that.
Seeing no seeing no one hands online or in the room, I just want to opine. I do see a hand. I'll opine, and then Dr. Robinson, go ahead and proceed after. I do believe that we should continue to serve. This committee is extremely important, and we should meet once a month to stay updated regularly on the concerns in this district. That's just how I feel. I think sometimes, we had a system, go back to the system of relevancy, the topics, the agendas that are relevant to the issues that we need to address and how they are relevant to this committee. But I do believe we should continue to meet at least once a month and take in those 2 breaks, I believe in December and July.
Summer, July.
December and July. Other districts, we have throughout the state have someone sitting on these respective committees. We are one of the only ones that get a break in December and July. Broward, for instance, they meet every month. Miami-Dade, every month. They don't get a break. So that's just my little 2 cents. Dr. Robinson?
Yeah, thank you. So, yes, I agree with you. I think there's a lot of work that needs to be done, but I think that we also have to find ways to become more efficient, and I think we could talk about that in the future, including making sure that we're looking at, well, for me, I think that there's data that we need to continue to look at, follow up on, and then make the recommendations and then follow up on the recommendations. But I think we have a circle that we need to go through to really be effective. But for the question at hand, yes, once a month, I would hope we would stick with. Thank you.
Thank you. Just online, for the records, Mariana Blanco said, I agree with meeting once a month. Things change very quickly throughout the year, so I believe it is important to continue this. Marcus Brown from Palm Beach County, PTA, I also agree with meeting monthly. Any questions or comments in the room? Seeing none. That was Marcus Brown, Palm Beach County, PTA.
That's correct.
Okay, so I will bring the proposed dates. So typically we look at the 4th Thursday. It doesn't always work out that clean. Sometimes it's the 3rd Thursday. And I know one of the Thursdays, I'll be at the Council of Grace City Schools meeting. So we'll probably try to flip that, but I'll bring the proposed dates for approval at our next meeting, which following what we currently do in September.
The 21st, 27th,
28th.
28th, Thursday, yeah.
Yeah, Thursday, September the 28th, which will be the 4th.
May I offer a motion on the floor? I'm going to step down as chair. Mr. Chair, do you want to take over as chair so I can offer a motion?
Go ahead. Go ahead.
As the vice chair, Charmaine Postal, I would like to submit a motion that we, as the body, approve a calendar for this month as consistent with previous calendars on the 4th Thursday of the month, with the exception of those months that are conflicting due to holidays, that does staff come back to us with a calendar for us to vote on next month. But however, we have agreed on meeting for the 10 months out of the 12 months of the year, and
Or if it conflicts with my schedule.
or if it conflicts with your schedule. Well, present to us next month a so the motion on the floor is having staff work on a calendar to present to us next month that is consistent of 10 months with the December and July month off.
Any seconds?
I'll second.
Jack
Scott.
Jack Scott from FAU Card, second.
Any opposed?
No, any discussion?
Any discussion? All in favor? Aye. Motion
Aye.
proceeds. No opposition?
Nope.
It goes down.
Thank,
Thank you.
Okay, so next, that's good. Continue to move forward. We'll bring,
Motion to give it back to Chairman.
the chair.
okay.
Go ahead. Mr. Kiwa, go ahead, continue.
Okay, so one of the things, and Dr. Robinson, your comment about more efficient, I thought we got a lot done last year. I thought, I was really proud of the work, despite all the challenges that we face. Given that, one of the things that we talked about, yeah, I was just partially joking, Dr. Robinson, but go ahead.
Yeah, like, okay, don't call my name and don't expect a response. So, no, so I think that might be part of it, though, is to see the impact of our recommendations, what happened to it, how it went through the system, and ultimately, how did it impact children?
So, given that, that's a great segue to 5.20, school mental health crisis response. So, over the last couple of years, this committee has been involved with this policy, providing feedback, and Dr. Musenik, who's the director of the Behavioral Mental Health Department, one of the things that this committee wanted was to have updates on that. So we wanted to provide updates from last year and kind of what's occurred, look at some data around this particular policy, and how we do our work as a school district. So Dr. Musenik, I'll turn over to you, and then I'll just jump in as.
Great, thank you. Happy to give updates here on our policy. It was, a third revision was workshopped in June and went to development in July and is going before the board on September 6th for formal adoption. There were some minor changes from the last version. We keep getting better, and we have had a lot of input. One was updating the definition of developmental disabilities, so that was revised within the policy. And also the reporting requirements to Florida DOE was revised, because before they didn't have a database, so we just said we had to report up. The superintendent had to make the report. Now they provided us a database, so we use that database. So we had to change that language within the policy. And then the method of transportation was clarified as well. So there is an option, and there was language put in there about using unmarked police cars if available. Additional language was also added regarding reporting of suspected abuse and neglect. You know, that is a requirement across the state, but we took the opportunity to put it in this policy as well. And then just grammar and text placement was revised for clarity and understanding. So that was for that. So that is going forward September 6th, so all is well there. Part of the policy requires that we have a stakeholder collaborative, and it took over, we kind of replaced the adolescent collaborative that we used to do with JFK and Sharon Tarlow. She was so nice to hand over that meeting about reviewing data and children's involuntary examinations. So we took that over as a school district, and currently it's called the 5.20 Student Mental Health Crisis Response Stakeholder Collaborative. So we have a lot of representatives on there. We have the Mobile Response Team, which is the county team, Southeast Behavioral Health Network representative, JFK Hospital, Palm Beach County Sheriff Office, Pediatric Partners, Youth Services, and then a variety of departments that represent the school district as well as principals. So we get a good group on a regular basis in that meeting. During that meeting, we share the data regarding student crisis response. So we do share it across, we hear from JFK, we hear from the sheriff office, we hear from the school district, and we really want to just share what's happening all the way across the county, and certainly from the mobile response team. And then our next part of the meeting is, once we report out that data, is really to take a look at the data trends and opportunities for continuous improvement. of services that really support our students and families. So just an example of some of the things that we've done. We realized that we needed more collaboration with the community, not just on this week, on the monthly meeting, but our CAPE team, our crisis team meets with the community mobile response team on a weekly basis, just to kind of review the cases to make sure that we're covering and we're all on the same page. So we've found that really helpful. I know Michelle Beatty's here. She's made some processes and changes at JFK, and we've been working collaboratively with them. And then we did some reorganization of CAPE teams so they're closer to students, so response time is quicker. And then also we worked and have an MOU with Southeast Behavioral Health Network, making sure that the community mobile response team and ourselves were using the same assessments in the same manner so that everybody's on the same page. This is, I provided some data in terms of SY22 and SY23, so last year's data and the previous year's data. These are the first years of data that we've collected as a school district. Before, it was collected by police and the health department and reported to the state, but now we're collecting our own data. So in SY22, we had a total of 108 transports. Really, when you look at district comparisons, we were very low compared to some of our large districts, more female than male. And then it was pretty evenly divided between our black, white students across the district.
Can you explain ethnicity for Hispanic?
Well, we have had that question because we have white non-Hispanic, we have Hispanic, we have the black Hispanic, those that identify as Hispanic and non-Hispanic. So it is mixed in there. If we were to parse it out, we would have so many different categories, and we do have a little bit of data around that further down. But we have had questions about that.
Can I ask a quick question? What is the consistency of the data? When you look across the different angles, it shows lack of consistency or lack of consistency in collection of the information. So it doesn't appear to match the outcome.
So the consistency in the data collection changed 2 years ago based on a state requirement. So we have to complete IRS, I forget what it
We
is.
have the involuntary examination reporting system now. It's called IRS with Florida DOE. So and it's a form that schools go in and they report the data, and they have required fields in there.
And so that started 2 years ago, where there's now statewide some data where there can be comparisons from districts to districts. So we were able to see the FY22 data. We haven't seen the other districts for FY23 yet, but we have ours coming up. But we were much lower than the other large urban school districts as far as number of transports. I do want to talk about
Just give me 1 second, because we had a hand. Dr. Musanik, would you rather continue with your presentation and answer later or throughout the presentation?
I think it might be easier because I do have comparisons between SY 22 and 23 and, by grade level, and I have some ESE data, so I know there's going to be a lot of questions around all of that, so maybe if we save it to the end.
Save the questions to the end. Okay, go ahead and proceed. After the conclusion of your presentation, Kimberly, you can proceed with your question.
No problem.
Perfect, thank you. The reason for suicide risk, we took this off of the suicide risk assessments to see and kind of gather data. The top 3 reasons were family complications, there were issues at home, feeling like depressive symptoms, not necessarily depression, but sadness and hopelessness and low self-esteem. Those are the same 3 you'll see when we pull up SY23. The top 3 reasons are the same the past 2 years. So some of the other reasons have shifted, shifted in the order, but those top 3 have remained the same. Okay. So we divided it by regions, and it's part of our deeper dives for data. We want to see, is one area of the county having more transports than other areas? We've even broken it down by zip codes on occasion. But you can see our the south, central, and north, they're pretty even. They have been even for the last 2 years. What is interesting is charter is a big chunk of our transports. There's a small number of schools compared to our district schools, but I think they're right around, it's right around 40%. Yeah, this is SY. Did you jump ahead, Keith? This is SY. Okay, 23. No, this is, okay. No, this
It's
is
23.
good. Okay.
So last year we had 108, this year, past year,
113.
113.
So a big percentage of those are the charter schools, and we're working really closely. I have a team working with the charter school department and with those charter school principals. We do respond to the schools. We try and provide as much support as possible, but we're working harder in that area. So just by school level, our biggest chunk here you can see is middle school, especially 7th grade. You'll see that in the data as well. High school, elementary, obviously, is less. So the transports by grade level for SY23, 7th grade was our largest number of transports, and then it was pretty even between 8th and 11th and had dropped down for 12th grades. And then again, this is SY 23. It compares, it's almost identical to SY 22, 67% female, again, 2/3 are female versus male. And then by race, this is divided up a little bit better than the first cut of data because this is based on our IRS and we really tried to get into the data a little bit better than that first year. So you can see, though, we have white and the black, non-Hispanic is about even again. So those percentages have stayed the same from year to year.
And these are the fields that the DOE requires.
So again, this is the same, referring to the previous slide. Again, you see those top 3 reasons for the suicide risk was, again, family complications, depression, and low self-esteem. And then the remainder ones kind of shifted some positions, nothing too radical, but the top 3 reasons for having suicidal ideation has remained the same over the last 2 years. I know this data is of interest, especially Kimberly, you're online there. And this question, actually, I was on the phone with FAU CARD yesterday. I see Jack here. Hello. And the data, surprisingly, it's not EBD, our emotional behavioral disabilities, but our other health impaired and students with a specific learning disability. Those are those acronyms up there. OHI is other health impaired, and SLD is the learning disabilities, students with learning disabilities. So that's really makes up the larger percentage of our total of ESE students, and out of the total, we have a little less than 1/3 are ESE. So we had a lot of discussions around professional development last time. I know some of you had reviewed the Jason Foundation, which was our suicide awareness and prevention education module that we were requiring school staff to take. And you all reviewed it, and there were some feedback in terms of not being in depth enough for ESE students and really not having enough of information for our LGBTQIA students and how suicidal ideation really affects those groups. So we took that to heart. We really did. And so based on that, one of the first things we did is create a committee and work on those new presentations. They did a review of what would be out there that would suffice and really fill in those areas. And what they found they weren't really happy with, so they started to create their own. So working together collaboratively, the district and FAU CARD and, we had several, NAMI, we've had several people and actually it was a large group of people, that put together the suicide prevention for students living with or impacted by autism spectrum disorder. That is a training now offered in our electronic learning management system, and the suicide awareness and prevention for LGBTQIA+ was created and is available to staff. Okay, so those are new. What we also did is we took what you said about Jason Foundation. I want you to know Florida DOE still has that same presentation that no one really cared for, is still one of those options up with DOE. But DOE also had the option of we could provide them with a training that we thought was really good, and they would go ahead and approve it. So we do have a contract with Vector Solutions, and they had a suicide awareness and prevention training that was 2 hours that fulfilled the requirement for Florida DOE. We went through the process with DOE, and they did approve the Vector training. It's much better. It is interactive. It's really, we feel, a better product, and that's what's in the system this year and required by all school staff to take. So that we followed that recommendation. So those 3 things were done. In addition to, we had youth mental health first aid that was a requirement by the state, and that was all across the county. I have some data on that to show you. This year, we combined the suicide prevention from Vector with a mental health referral process with district policies and procedures, and we put them together in a single, like, 2-part presentation. So staff are required to take that presentation, and they will get both the how to make a mental health referral for students as well as a suicide awareness and prevention training. And I have data on that for you as well. We already talked about the revised policy. The Columbia Suicide Severity Rating Scale, we have all school-based mental health professionals have already taken that training. If they haven't, it's back in their compliance courses again this year. In addition, there's 2 trainings out there. One is a briefer training, and then one is a longer training for lifetime recent. And we have now loaded that lifetime recent training in for all the mental health professionals to take that. Then we also have de-escalation beyond the basics that has been there. That was in collaboration across departments, and especially with our ESE department, our neighbors, and that has been in ELM. And we also provide suicide risk assessment technical support training for school-based mental health professionals. And then we have a technical training for involuntary examination, restraint, and seclusion, and how to use that IRE system that we spoke about. And then we created a badge for school district personnel. So if they take these courses that are listed up there, that are on that bottom, the de-escalation strategies, self-injury and cutting, student mental health awareness, intervention and referral, the autism course, and the LGBTQIA course, they will get a badge. So they have a badge that they can put at the bottom of their signature, and they get points, continuing education points for that, and it's available to all district staff. Okay, so that is, I kind of reviewed that on the last slide. We did use the Vector Solutions, created those trainings, additional trainings, but a special recognition really goes that suicide preventions for students living with or impacted by autism spectrum disorder was nominated for the Hats Off Community Collaboration Award. So there is a number of people. There was Dr. Kraft from my department. We had worked with ESE. We had Kim Berryhill and Cheryl Harris. Pete Stewart is here. He was part of that. Michelle Beatty, Catherine Murphy from NAMI, and of course Mary Ellen from CARD was really working together collaboratively to create that training. So we're very excited that's coming up in October. So they have been nominated, and hopefully we'll win that award. Just an update on youth mental health first aid, our participation, we really led this across the state as a district. We ended the year at 91.8% of staff, required staff, had taken that training. So you can see that data, the total certified, and that's a 6.5-hour training. And we were required to meet the 80% mark for this year, but we have certainly exceeded that, and we were very excited by all the hard work. And this was, we had over 130 youth mental health first aid trainers, and we offered up to some days, there were 6 and 7 classes running simultaneously to get this done. This is this year's data already with our new course for suicide prevention and the mental health referral policies and procedures course completion. We have just over 22,000 people enrolled, and we already have 8,000 people who have completed this training, and we're still in August, so that's good. And we have just over 1,000 that are in progress that haven't completed it yet. So I think is
That's your last one?
yeah, I think so.
Ms. Kimberly?
Okay. I still have a bit of follow-up questions. You said approximately 1/3 of the total population of students who are Baker acted are ESC?
1/3 of our transports.
Okay, transports.
Not of the population, of our transports. It was 31.86%.
Okay, 38%.
31.86.
Okay, sorry.
Yeah.
What percent of ESC students are in this total population of students this year?
I think the last, according to our LEA profile, I think we were right around 16%, but I would have to look it up.
Okay, so there was a greater percentage. It wasn't representative of the number of students with ESC designation in the population. Another question I had was, I thought we didn't use seclusion.
No, we don't.
Okay, because I heard seclusion in one of the trainings, and I just wanted to confirm it hasn't come back.
Escalation. No, we don't use seclusion. It's escalation, de-escalation training.
Okay, thank you.
Anyone in the room before I'm going to alternate from the room. The hands that I saw was in the room is Mr. Jack, Ms. Debbie. So I'm going to go with Jack first, Dr. Robinson, and then Ms. Debbie.
In relation to the previous question, I know that persons with autism, including youth, are at least a 3 times greater risk of suicide, with those with at least one co-occurring mental health condition can be as high as 9 times greater risk. So in my mind, it's logical that we would see a higher proportion, certainly in autism and probably with some of the other disability areas to help account for that. But I think I'm very gratified to see the number of children with autism down to 2, and my perception is that it was much higher previously in the autism area. And it seems that the focus of these efforts is really for suicide prevention and helping make sure children do not commit suicide. And I think that's a very good thing that's happening. And I think it brings it appropriately to where the intention of the law and what the school district should be doing. So I want to compliment you on these efforts. It seems like they're very encouraging.
Well, thank you. And also know that these categories, I mean, we label children unfortunately, but there's a lot of comorbidity here. So it's not necessarily, just a SLD child or just, this is their primary eligibility, exceptional student eligibility. That doesn't mean they don't have other things happening. So just to clarify.
Dr. Robinson.
Thank you. So actually, Mr. Oswald, this is a good example of the advocacy of this committee going forward, changing something in the system and positively impacting students. So that's what I'm glad to see. But I want to also follow up on what Kimberly said, because I was thinking the same thing. So when you present the data, it's like ideally we would see it, instead of saying that like Black and white students is a similar number, there's a significant disproportionality. And like Kimberly just pointed out, there's a significant disproportionality with students identified as ESC. And whether or not that's, whatever that's tied to, I think is what we need to, what I would hope we would work on figuring out. I would also like to see like the information about the suicide, the reason for the suicide risk. I'm curious to know if that can be disaggregated. So like by race and gender and ESE status, because I wonder if like everything else in the world, if race impacts that, because then the solutions, the supports, the wraparounds, the whatever it is that we need to lower these numbers would be different if there's a different reason and by some identifying characteristic. So if we could just see the data in more detail later, I'd appreciate that.
And I just want to jump in and respond to that comment too. One of the things that happened when we share the data, Dr. Robinson, in the collaborative meeting that Dr. Musenik talked about, and Michelle is in there as well. So the different agencies are going to share out their data and a number of transports. So what has really been an eye-opener for me is a number of transports that happen outside the school day. So over the weekend, in the evenings, is ranging, and Michelle, keep me honest, but I think it's multiple hundreds a month. It ranges, obviously. And one of the things trying to figure out, and Michelle has been sharing some of anecdotal data with the community about how do we really get the support out to the community, because clearly we're addressing one issue while in the school day, but there's still a lot of challenges happening in the community and for parents that they're going through where they need assistance and support. And how do we, make that happen? And I think that's a appropriate discussion in the future for this group to talk about as you touch a lot of different community representatives. Michelle, I don't know if you want to add on that issue.
We do see the majority of the inpatient admissions coming from places other than school. School is definitely the lower incidence of locations where children are transported from, whether it is a Baker Act by law enforcement, the different municipalities, from the community versus home, and also from ex parte orders from the courts. So there is the lowest incidence is from schools. We certainly are working to track that data and share that to collaborate to work with the teams.
Thank you.
Can we see the disaggregated community transport data? Is the question that's in the chat.
We can take it back to the committee and see if that's something, we don't have that data, so we would have to reach out.
Yeah, that data is reported at our monthly meeting. Michelle's great about reporting that out. We would have to go back over those agendas and we can graph that for everybody.
Thank you. Debbie Ellman?
I could shorten your work with that. I do have
Perfect,
some
thank you.
spreadsheets
Great.
that I work through.
No problem. Thank you. 2 questions. Can we have access to this presentation?
Yes.
And when you talked about the new language for reporting suspected abuse and neglect, can we have access to that new language as well?
It's not necessarily new language. It just is language we included in the policy. And let's see.
So one of the suggestions that came forward is that to make sure that if you are working through an issue of a student who is at risk, that it doesn't, and because you're working with it through a suicide risk assessment or other process working with an agency, doesn't preclude if their student discloses any type of abuse or signs that you need to still report that, even if you're still working through an issue. So it was clarifying that language in the policy. But we can send the policy that's going to propose to be adopted on September 6th as well.
Yeah,
which
it's
you'll see.
just one line. It just reads, nothing within this policy is intended to supersede an employee's mandatory obligation to report suspicion of abuse or neglect to the Department of Children and Families.
So no changes really in that. And just interesting point, I was very interested in the numbers of male versus females being transported, seeing that most of the shootings that are occurring are by young men, and it's interesting that they're definitely flying under the radar more than females are. By the, it was only 33% compared to 77, something like that.
Mhm. Yeah,
Yeah, interesting.
absolutely.
Thank you. Emmy Kinney, you're recognized.
Thank you. First, I just want to say that I am thrilled that our recommendations actually went somewhere and created some kind of change. So I just want to thank Dr. Musenik and your team for taking our recommendations seriously and putting that committee together in regards to the trainings. I'm wondering if we would be able to review those two trainings that you mentioned, the one about LGBTQIA youth and the other about students with autism.
That shouldn't be a problem. I know you had requested to review trainings in the past, and we didn't own them, so there was a copyright issue. But since we created these, I don't think it's an issue.
That would be great. Thank you.
Prior to calling on Kimberly, is there anyone who have not spoken on this topic who would like the opportunity to speak at this time? Hearing none. Kimberly? Oh, I'm so sorry. But you were answering a question. Go first, and then I'll take Kimberly. Since we're out.
I just wanted to know if with the trainings that are developed, if there might be a component with how to welcome students back into the school after involuntary hospitalization. I know that our Section 504 teams, our child study teams, our school-based teams are led by professionals who are trained in that. However, I do believe there are some misunderstandings among other school staff about how students are welcomed back, how to reintegrate into the school environment, and also the requirements. I know that some are under the impression that parents will be absolutely required to present discharge paperwork in order for a child to be able to access school. So I think that there might be some room for additional growth. My only other comment was when looking at the ESE data, I think it's important to note that there is a correlation between other health impaired and emotional behavioral disabilities, and that won't be reflected in the LEA or SEA profiles when you're looking at students who have been identified under OHI as an eligibility for a medical diagnosis related to mental health.
Yes, absolutely, absolutely. There's a lot of comorbidity in our different areas.
I'm raising my hand, but go ahead, Kimberly. I'll let you. You're recognized.
Thank you. I had a question I forgot to ask before, and I wanted to know what about multiple reasons for suicidal ideation, such as a student may be depressed due to their LGBTQIA+ status, or because of being abused at home, that some of the family complications could be child abuse, etc. So I'm wondering if there could be like breakdowns of family complications and breaking them down, because I really think a lot of these are interrelated.
I would agree. The suicide risk assessment is, part of it is an interview. So you're asking the students, the children, their plans and some contributing factors, which they're writing down by hand. So when my team went through this, they tried to create the categories, and it's really qualitative data that they have now converted into quantitative data. So it's not just fields that someone would connect and see like, oh, there's 3 different fields marked, so these 3 things are impacting the student. So we're really taking qualitative data. We did it as deep of a dive. The time allowed, certainly reviewing all of these suicide risk assessments to break it down. I take certainly what Dr. Robinson said, that we could further break it down. It would be a little bit easier by looking at gender and ethnicity and race to see if there's some patterns there. It's probably going to be much more difficult to take that qualitative data and take a look at the overlapping reasons. We can certainly try.
Thank you. And then I just wanted to comment that a lot of parents will transport their children because the rule about transporting students is that parents need to be notified, and many parents decide to take their own child and agree to have them assessed by a professional. And so I wonder how many of the ones that are outside of school were really initiated in school and the parents took the child after determining with their private professionals or even without that to involuntary assessment, how many of those really initiated in school? And I don't know if you know, well, you might know the answer because the parents have to provide follow-up as to what they did.
Well, we certainly encourage parents to be involved in the process. So we would not have a way of tracking what the parent actually did when they left school grounds. We certainly are collaborative, and we want to be working with them, and we encourage them to share that with us so we can support the children appropriately. But we don't keep that data of whether they go into a receiving facility or their pediatrician or a counselor. We have no way really of tracking that data. The individual schools are following up with the individual families as they're able to.
And we're very transparent with the family, obviously, with what's happening, to the point where if we're not transporting and there's concerns, that we are letting them know in writing that there are concerns. Again, I want to be very clear that we're trying to work on the prevention piece, but at least the data I've seen last is that the leading cause for teen death is suicide. And so it's a real issue. So, and understanding those issues around there. And, we've had some real tragic cases last year that we have to look at, right? So, and how to do better. So, yes, the numbers are down, but I want to be clear. This is a significant issue.
Thank you.
So I had a question. Earlier in the slide, I believe you alluded to the task force.
It's the collaborative meeting.
The collaborative meeting. And one of the things that I did not notice, and I know there were multiple, yes, you can go back to that slide. There were different, right, I think go back.
It's the third slide.
Right there. When you look at this, there isn't a specific parent group here, representatives, where you're getting that parent perspective. There isn't any students. I see the county youth services, and I'm not sure if students are represented in this meeting, but the question that I have was, have the district ever considered training students in regards to trauma-informed care or some form of identifying mental health crises amongst their peers? Because at times we look at teachers and we look at, JFK North and all of these other respective collaborators, but the boots on ground is our students. They're the ones that are right there experiencing exactly what their peers are going through. 9 out of 10 times, their peers are aware of some of the signs before half of these representatives are even aware of a sign. So I noticed maybe a chapter to take out of Columbus, Ohio. The school is Hillard Davidson High School. They have something called the Hope Squad. So I'll stop there and let you.
Yeah. Well, we have a mental health curriculum that is required for grades 6 through 12. And that is, they do cover signs and symptoms. They talk about things to look for, how to get resources. They also, they talk about suicide awareness and prevention. So that is part of the curriculum that is required for every student from grade 6 to 12, okay? Also, in the back of the badges, we've had the suicide awareness, the suicide crisis line, and the text information on every student badge grades 6 through 12 for the past 2 years as well. So definitely we're talking about it more. September is Suicide Awareness Month, so we have a number of different activities and information that's going out to
Teen
schools.
mental health first aid.
Yes, we also have I think it's 9 schools now.
But we're trying to get
10th
more.
grade teen mental health first aid. So it's a course where they get direct instruction. It's similar to our youth mental health first aid that we give the adults, that we do for teens over a number of, I think it's 5 different sessions in person. So that is also going on.
We're
How
trying to
do
get that.
students how do students get informed of these trainings? Or
Well,
what
first of all, it's
students?
part of their curriculum, so.
Okay.
they-
For the first one, not the
Yeah, the
teen,
first
but-
one. The first one is part of their curriculum, so they all receive it.
Right.
That's how
The
that
teen
is
mental health.
informed. The teen mental health is just at certain schools.
So each school identifies a coordinator to start listening 10th graders. We received a grant for this, but we're working to hit all the schools. It's well received. But students, to your question, really get, the strategy to look out for their friends. We've seen more and more. I get all the Fortify Florida tips, even as late as last night, where students are reporting anonymously other students who appear to be in crisis. One last night was a student was going through a breakup. He seems real depressed. She needs help. So the school gets that alert. We're able to follow up. So students are using the tip line more to refer other students to, which really has shifted a lot over the last year. Because I see everyone that come in, and it goes off. It's going off every day. So, but it's good to see the kids are referring that way as well.
Thank you. I just would like to see.
Quick question, following up, you said that September is Suicide Awareness Month, right?
Correct.
It so happens it's also Hispanic Heritage. So could some of this information be translated and be available in Spanish so that the parents knows about it and the awareness level among the students goes up?
Yes.
Because, a lot of the feedback we get is that Hispanic students are not getting enough help, quote unquote, So how can we help make that awareness, be?
Yes, absolutely. We try very hard that anything we put out, that we put it in the multiple languages. So it's in Spanish, Haitian Creole, Portuguese, and English. All of our official communications, especially with parents. But I will definitely take a note of that for anything going out for next month. Thank you.
So the answer to, just go back to, thank you for that, but to go back, there aren't currently any students or parents that sit on this as a representative.
When we started it, we had made inquiries through the regions and asked them to please nominate, and we asked if anyone knew of any parents that might be interested, and we hadn't had any feedback. So that was actually a standing agenda item for probably the first 6 months, and we haven't. But if anyone is interested, you are certainly welcome.
Sitting in a seat as a PTA, and we currently have a mental health chair that sits on one of the largest children advocacy groups, we were not even contacted. The PTA is one of the largest agencies with 10,000 members in this district alone, not ever approached about that conversation. So I'm just going to throw that out there to even solicit other members, not necessarily the county PTA or anyone else, but that was not out there. When this collaborative effort came forth before the DDEC, we had asked that there is parent or student representatives, and it was said that it would be taken into consideration. And this is, again, the feedback is now, or this follow-up is the first time that I'm seeing again that there is no parent representative or student representative. But that's something to consider, because the first steps of who you're working for and who you're working around regarding this is those who deal with it on the nitty-gritty, the grind every single day, those parents. And then your teachers. I don't know, of course, the district staffs represent the teachers, and then your students who sees it every day, who are the ones that might be holding that friend who's going through the crisis. When my son went through a crisis here in this district in 4th grade, now he's getting ready to graduate, it wasn't the teacher, it was his peer. And then when we came back, going to your point, when we came back, it was me who got the calls about the weird looks and from the teachers, not his peers, but from the teachers. So, the people who's going to share the stories about the real issues that's going on, you don't have them represented here. That's what I'm going to leave it at that. But just for consideration, it's not something to answer right now.
Yeah,
but I also wanted to answer.
But I do want to talk about that, because we do want to add a parent, because we've talked about that numerous times, that we want to get a parent representation. So I didn't realize PTA had this mental health group.
Yeah, we have a mental health chair.
We can add additional groups. This is not, anybody who wants to help problem solve to do better in this space is more than invited to come. Anything that's shared is not, student information is not shared, so there's no issue around there, so it's all public information. So we would love to have that, Madam Vice Chair. So if you can give us a name, we can have them on. We meet monthly.
Also, if we could have the chair, or the mental health chair, I'm not aware of them. I would love to work with them. We have a whole department, so this is the first time hearing about it as well. And that's what's so great about these meetings, because then we get to hear what's happening. So I would love to work with them.
And if there's a recommendation for a parent, more than happy to add a parent to this meeting. One of the things that came up, I meet with a local pediatricians group, and, they brought up this issue throughout the years, so we added them to it. So, and they're working closely with getting the word out to all the pediatricians in Palm Beach County. So we do have representation there that they started coming last year. It was enlightening, and a lot of problem-solving and communication issues came up just from that alone. Transitions being one of those as well, so that we have to work through.
And be aware that at least 10 to 15% of those parents who are Hispanics, or they might be from Creoles, or they might be from Brazil, or they might be, they don't speak English. So they don't understand this or what's going on, so that information had to be already for them at a level that they can understand and how can they react. The process from A to Z, so that they understand it. So if not, we're back to square one.
Another question, I see you, Caesar, just give me one moment before you recognize. Just want to read the questions that's in the chat. How many transfers were due to danger to others as opposed to danger to themselves? That's from Dr. Robinson.
They were actually, I didn't put that data in there. It was a very small percentage of these transports. That's a good question. It's very small. In any given month, it's 0 to 1.
For danger to
For
others.
danger to others.
Thank you. Another question from Kimberly, following up on Dr. Robinson's question, is that I have observed that alleged threats to others are handled by arresting or expelling those students rather than transporting them for Baker Acts. And it will be interesting to get the demographic statistic on that. With new federal funding for school safety efforts, I hope the district places a priority on mental wellness initiatives and staffing over increase in police presence, and possibly sending out info about the groups seeking parent and student representation as part of the materials sent out for the Mental Health Month. Before opining on those from
But I want to set the record straight regarding arresting or expelling students rather than Baker acting them. That is, if that's happening, then we Dr. Musadek's team is deeply involved in any transport, and schools would be breaking policy if that were to occur. So I've not heard of one incident. So Kim, if you have specific incidents, then you need to bring that forward, because that would be against everything that speaks to this policy.
Before opining, Kimberly, I'm going to recognize Caesar as he has not spoken at the time. Caesar, you're recognized. Caesar, if you're speaking, you're on mute.
Yes. I was on mute. Sorry about it. This is very important for us, and especially for the Spanish people. This information has to be passed to parents and also other partners in this meeting. I would like to have data about, I know they give you total transport, south, central, north, glades, but by schools, because that can happen in the environment on one school to another school. And if that is happening, that one school has higher statistics or numbers of transport, that we as responsible to allocate more mental health specialists or more actions on those particular schools before they happen. So this data in advance could be very important to prevent any suicide or any kind of crisis. I know this is we are like everybody working in the jobs in different ways, there are some kind of jobs environments because of the teachers or because of the any staff situations that can be transferred to the students. We need to assess all of that information. So I would rather to have all those data by schools for allocation of more mental health specialists on those schools. That's mine.
Okay, just on that question, we cannot provide that information as the numbers are very small, extremely small, and you could essentially figure out which students were transported. So we cannot provide that to this group, our data, because of FERPA. I can tell you that our policy does require that any school, once they hit over 2 transports in a quarter, is it?
Yes.
In a quarter, require us to intervene from the regional office and the district office to see if additional training is needed. I can tell you that's one of the things we monitor internally, and there is no outlier at all by a school. That's one of the things we look at closely.
But can you monitor the staff of the school, like the teachers? You can sense, look as good as like a sense how is the mental health of the whole school for the staff and see maybe I cannot assess. Means is no we cannot control what happened in the family houses for those students because they're out of the school. But maybe we can control what happened with our staff, with our teachers, with administrative leaderships. We can control that. So that's the data that maybe we have to put it out, I think.
So there's other factors we look at when we look at the kind of the school culture and the temperature. So we'll look at discipline, when we've done this here, looking at discipline data, looking at our school effectiveness questionnaire, which there's some questions which I mentioned earlier regarding this peer-to-peer relationships challenges. So there's other factors we look at as far as measuring that. That's where we gauge those kind of issues and challenges. I think we got.
Available to student activity committees to whom? Go back up, I mean, down.
I'm gonna respond to that.
I think you have to just respond to that in the chat. We acknowledge that someone will answer that question, Kimberly, of to whom should I provide the info?
Which one?
May I quickly just add, regarding my comment about the federal funding that is being sent out for school safety efforts, some of it could go to, it's up to the school or just, the district. Some of it could go towards more policing. Some of it could go towards mental wellness measures. And I would like to propose to the district when that funding comes down that it use it for the mental health / wellness efforts, getting more staffing, getting more resources to it. And I don't know if that is something we would want to recommend as a committee, or do we need to wait until the funding becomes available at our level?
So we brought one prior to this group for support letter. Most of the funding that's come through, there's a lot of strings typically. We have partnered and got a couple of the mental health, but they're really through FAU for getting more counselors, master's program in counseling, because of the shortage of workforce in this space. Is really the challenge I think Dr. Musenik feels with working with all of our agencies. So we have, is it 10 agencies?
Yeah, well, I mean, there's a real issue out in the community in that there is not enough qualified mental health professionals in which to hire, whether they're going to be working for us or for one of the community agencies. So that increasing that pipeline has been a priority for sure. So we are partnering with FAU and the counseling program. We also have our mental health tech program that's going on in the schools. So, that's definitely on our radar. But we're looking for alternative ways to support students as well.
Okay. I just would love that funding to go towards your work as opposed to adding more police officers.
I do appreciate that. Thank you.
And I got to be honest. I mean, thanks to the referendum, we're in really good shape. One of our biggest challenges is retention of staff. Dr. Museni, I hate when she calls me because I figure she's telling me someone else has got to go into a private business or doing something else. There's just, when we actually find licensed people, they're just very difficult to keep. So
Is it more lucrative in private practice? Because if so, we could use funding to increase salaries and benefits.
Well, we did increase our co-located funding for the agencies that participated in the co-located therapists that are located on our campuses, and we did increase them this year. We recognized that they had pressures as well as us and out in the community, so we increased our reimbursement to the agencies, and we would certainly look at that again. But it's not like we're on an even field here. We have people who are licensed that can go and, well, they can stay in their home and do teletherapy, and they're making $150 an hour. So that we're not even close to competing to working at home in your pajamas, making that kind of money. So, that's where we struggle.
And I will say, in our law enforcement, I mean, Chief Mooney has done a phenomenal job of really doing a lot of training for law enforcement and understanding this. Just in July, we brought in, again, this is the second year, the FBI, who did a whole, last year they did it, and this year, really addressing the pathways to violence. We had a speaker or a survivor of the Columbine speak, and really working around prevention, intervention, getting on the front end for law enforcement, building relationships. And our law enforcement does a really good job around building those relationships. They're helping prevent issues from getting to another level. And I think having our police force has really served us well over time. I'm not saying in every situation. We always have those extreme situations that will arise with employees. But we have that control for the training.
That's interesting, because when we had the training subcommittee, they refused to tell us what trainings they offered, if you recall.
I mean, they're law enforcement. I don't know. I'll work with Chief Mooney to try to figure out that. But I can tell you they do a lot in this space.
Okay, thank you.
All right.
A comment?
Yes.
The term intersectionality hasn't come up, I don't think. But in terms of suicide especially, when there's that convergence of identities that are often seen as marginalized by our society, whether it's race, gender, disability, at that combination point, risk seems to go up very, very high. And as we know, even this term is one that's certainly not in favor at the state level right now. And if they could, I'm sure they would ban it. But for our understanding and for the school's understanding of suicide risk especially, I think it's a term and concept that has to be in there. And it does relate very much to diversity and inclusivity. So I'm glad this is being discussed here at this meeting.
Yeah, no, thank you. Yeah, we're definitely working around the challenges that we face with state statute and rulemaking. All right, I think we are finished.
Any additional questions, online or in person? Hearing none, any announcements for the good of the body? There's we've already shared a couple of Suicide Prevention Month, September. We've shared Hispanic. I don't want to hear the Hispanic Heritage Month. I didn't want to get it wrong. Hispanic Heritage Month, thank you. It's also PTA Membership Month next month, and any other months. I know we always have a slew of proclamations, so the school board will share with us what other events are happening in the month of September. If there is no additional items for the body or the good of this body, one motion and we'll be out here. Motion to adjourn by Debbie Elman, second by Mr. Juan Pagan.
Thank you, Debbie. I thought
Ladies and
everybody
gentlemen, have a great day.
Thank you all. Have a good week.
Thank you.